The 300 physicians' assistants making their voices heard at the Capitol this week, supporting bills that they say would make healthcare more accessible.
Yeah, they say that the bills they're advocating for would remove licensing barriers.
Joining us this Friday morning is Tennessee Academy of Physician Assistants President Marie Patterson. And we have talked about how Tennessee is really battling a shortage of healthcare workers. So we do want to ask you how this could remove those barriers and help patients.
Right. So, we haven't updated our practice laws for PAs in a quarter of a century. So we're taking a deep dive and looking at ways that we can help the patients in Tennessee access care more readily. And so we had some of these things in place during COVID, and we saw all the benefits that it could bring to the patients in Tennessee. And so that's what we're trying to do, is work on things to decrease those barriers. One is the licensing compact, and I've been to Washington 3 times now working on that, and that would allow PAs to get where they can practice in multiple states with one license, and so that's definitely going to be beneficial.
Dr. Patterson, what would be the next steps in trying to get this pushed through?
Right. So we have the bill in multiple committees, and then on both the House and the Senate side, and then it will come for a full vote if it makes it out of committees. And so, we're excited about that opportunity this session.
And real quick, you are a director over at MTSU. I'm curious how moving this forward could then encourage the future of PAs when it comes to students enrolling and knowing they would have options when they graduate.
Right. So the PA profession is a very popular profession. Every program receives multiple hundreds of applications, more than they have spots for. So it's a very popular profession. There is the need and the desire to go into the profession and help patients. And removing barriers and, for example, this compact would allow PAs, and Tennessee borders more states than anyone else with 8 states. And so you would have that option to work in multiple states, or telemedicine also, because you need a license wherever the patient is located if you're seeing someone. So it really would help increase access to rural communities and places like that.
All right, Dr. Patterson, we appreciate your time this morning, and we'll be keeping you posted on how this